Welcome to Jersey Matters. I'm Larry Menti. We come to you this week from Trenton, New Jersey. We are outside the Department of Health. In a moment, we will go inside to interview the new health commissioner, Shereef Elnahal, about a lot of issues, including the opioid crisis, a measles outbreak, and dealing with the dismantling of the Affordable Care Act. Also in this week's show, we talk to the Bergen County clerk about how he plans on keeping this midterm election Russian and voter fraud free. Did you ever wonder how those marches happen all across the country so quickly and so well organized? There's a group in New Jersey that helps youth get out on the streets to make a difference. And we'll take you to an amazing charity and talk to the two women who started Mary's Place, a place for women to go and fight cancer with support. And now, our interview with the new health commissioner, Shereef Elnahal. You have a lot going on. You had to hit the ground running. And I want to start with opioids because I think you would agree it is the #1 health crisis in this state.
Yeah, it's the one that's most concerning and impacting a lot of people. Almost 3,000 people are expected to die from an opioid overdose death in this calendar year. So we're very focused on it.
But the primary department, it would seem, when you go to the state's website, in handling this is the Attorney General's office and not the health office. And first, I want you to speak to that because many parents that we've talked to, that's one of the things they're the most upset about, is that it seems more of a law enforcement problem than a health problem. And if they change the paradigm, if they change the dynamics on that, more people could be cured and come forward for help.
Well, Larry, first of all, I'll say that you can't punish your way out of this problem. And I believe all of the players within the state that are focusing on this issue, including the Attorney General, understand that. When he was the Bergen County prosecutor, he brought in treatment throughout the trajectory of the criminal justice system. And I think that's what the Attorney General's office is focused on, and we're very much partnering with them on that. This is not a problem that one department can solve. We have to come together as a state to tackle it, and that's why the governor is investing $100 million of this year's budget into tackling the issue, spanning from prevention, making sure that where possible, hospitals and doctors aren't prescribing opioids if they don't need it. That's one of the more common ways that people become addicted, all the way through make sure people get treatment in the community, and then bringing treatment, very importantly, into the criminal justice system. And then finally, making sure our first responders, police officers, EMS have Narcan, the overdose reversal agent, to make sure that folks at the time of crisis can be reversed and brought into care.
I understand. It's not that I don't understand the law enforcement part of that, especially when it comes to drug dealers, but there are people that are addicted that are still getting arrested.
Right.
And many times it hurts their treatment and doesn't help their treatment. There seems to be a hole in the system that a lot of people are still dropping through.
And I think you hit the nail on the head. You want to make sure that folks aren't trapped in the criminal justice system because you're not tackling the root cause. And the root cause for a lot of folks is drug addiction. 80% of people or more are not only on drugs that are criminals, but also high while committing crimes. And so when you look at the statistics for people in jail, again, over 80% of them have an opioid use disorder or a drug addiction when they get into those jails. And so what we're all focused on, the Attorney General included, is making sure that we reduce recidivism, reduce the likelihood of people getting trapped in the criminal justice system by bringing treatment into place and making sure that they're able to thrive when they leave. A big part of it is preventing addiction in the first place, which again is why we're trying to encourage hospitals not to prescribe opioids. We have a hospital that's very good at doing that. St. Joseph's reduced opioid prescriptions by 80% in 2 years. We're trying to expand that as a best practice, making sure folks are getting treated in the community before they commit crimes, before they're caught with drugs or selling drugs. And we're very focused, again, on getting people out of this cycle of relapse.
I'm glad you mentioned St. Joseph's. They've been a national leader in alternatives to opioids. One last question on the opioid crisis, and that is, we've talked to a lot of treatment facilities and medical professionals who have complained that the state has just not provided enough beds. There's not enough facilities. And because of that, they have to push people through faster than they feel like they should. Are you trying to remedy that problem? Are you going to be able to provide more beds?
Well, we're trying to expand treatment capacity, Larry, and so that can mean a lot of things. You have inpatient treatment. You need that for particular folks who need that level of care. But a lot of people can be treated in the outpatient setting, and in particular with medication-assisted treatment, either with their doctors or with centers that are specialized in addiction treatment. They're called addiction treatment
centers. I think beds are just a euphemism that they use to talk about treatment.
Exactly.
So, but providing treatment and having enough facilities for treatment, that seems to be the problem.
And a good chunk of the $100 million, we're going to make an announcement soon on where that money is going specifically in terms of programs, is expanding that treatment capacity, making sure that more primary care doctors, family medicine docs are trained in how to provide addiction treatment, making sure that we are the licensing process to get more addiction treatment centers built and set up and serving patients is streamlined and made easier. And again, even expanding access to treatment within emergency rooms, like some progressive areas are doing. Some hospitals in New Jersey, like Robert Wood Johnson University Hospital, are actually starting addiction treatment in the emergency room when they see folks come in after they've overdosed. So we're really expanding treatment capacity. It's going to be a big focus of ours.
Wonderful. I want to move on to the measles outbreak. Out of nowhere, there seems to be a measles outbreak this summer. It normally happens at other times during the year. Is this because people aren't vaccinating their children?
We're concerned that that is a big contributor. These cases, for the most part, are coming from other areas, from abroad. But when they come to the U.S. and they come to New Jersey in particular, and if folks are not vaccinated, that creates a big risk because other people can get exposed and get the disease. And of course, the more people who have it, the bigger the risk is to the population. And so the biggest thing that we can do as healthcare providers, as a health department, is to encourage all children to get vaccinated if they can. There aren't that many reasons why you shouldn't, but if you have a medical reason, you're excused. And we want to make sure that as many people as possible are getting the entire schedule of vaccines, which will prevent measles.
Is the nagging fallacy that the vaccinations cause autism still out there? Is that still a problem?
It very much is out there, and unfortunately that narrative is not supported by the evidence. Multiple studies, large studies that looked at this issue with big populations have not shown an association between vaccines and autism, full stop. So that is not a listed risk when doctors are talking to parents about the risks of vaccines, and it shouldn't until if and when there's a study that proves that, and there really isn't. Instead, we see evidence that vaccines prevent thousands of illnesses per year in New Jersey, save hundreds of lives just within the state, tens of thousands across the country, and also save money because when you prevent disease, you save on costs, both from actual patients not having to pay as much, but also from insurance companies, which reduces premiums. So the case for vaccines is unequivocal. Everyone should be vaccinating their kids if they can, and we're very much encouraging that.
We have a lot more to talk about in the next segment. I want to hit on the record number of Lyme disease cases, and also how the state is handling the transition between the Affordable Care Act and whatever's coming next. We'll talk about those things with the Health Commissioner when Jersey Matters continues right after this.